Reducing chest breastfeeding disparities for health equity. Introducing continuity of care and breastfeeding support, a blueprint for communities. Human milk, the normative standard, the ideal first food suited for infants' optimal growth and development. Breastfeeding rates have increased in the United States, but persistent disparities remain. This is due to many unjust reasons that could be solved with an equitable approach to skilled lactation support across the community. To achieve chest breastfeeding equity, we need to tackle persistent inequities for optimal infant feeding and make chest breastfeeding the easy, feasible, default choice for every family in the community. In response, NACCHO and the U.S. Breastfeeding Committee, with funding from the Centers for Disease Control and Prevention, partnered and convened over 100 experts to develop a community-wide approach to lactation support, so families are fully supported and do not fall through the cracks during their chest breastfeeding journey. That approach is outlined in a new resource designed specifically for local-level organizations that interact with pregnant and postpartum families. The Continuity of Care and Community Breastfeeding Support, a blueprint for communities, launched during National Breastfeeding Month in August 2021. The blueprint uses the Continuity of Care framework to ensure that support services are continuous, accessible, and coordinated, and that community spaces are proactively supportive of chest breastfeeding. The blueprint features 7 recommendations in 2 areas: improving community infrastructure and building the lactation workforce capacity. Because each community is unique, community members and local lactation support providers should be seen as experts in implementation plans. The recommendations are: number 1, breastfeeding as a community health improvement strategy; 2, breastfeeding policies, systems, and environmental changes; 3, transfer of care accountability and referral systems; 4, community-driven chest breastfeeding data system; 5, public health, allied health, and healthcare workforce education; 6, family-centered care, implicit bias awareness, and cultural humility approach; and finally, recommendation 7, health advocacy and the local breastfeeding champion role. Together, we can improve overall community health and advance chest breastfeeding equity through continuity of care and breastfeeding support. Take advantage of this resource in your community. Go to breastfeedingcontinuityofcare.org today.